All right, by the clock here on the wall at the training center, it is 7 o'clock. So for those of you that have stuck through the elevator music long enough, just so you're aware, the reason we started it earlier is to share it to a few groups. You need to allow time for the administrator to approve it. And so if you wait too long till the deadline, then unfortunately sometimes you miss out and people are busy working in EOCs and other things like that. So to give everybody the best opportunity, we started it early. So when we do this again, you'll know for next time why it started 49 minutes ago, but we're just starting the class now. So obviously you see the disclaimer on the screen. Here's the situation: is not yet officially been approved. It has been received by the Pennsylvania Department of Health Epidemiology Group, and so they are in the process of reviewing it, but they haven't officially given it a blessing. So right now this is, the information is legitimate information. It is garnished from the Center for Disease Control's website and the Pennsylvania Department of Health website. It has been peer reviewed, but we can't say it's official until DOH or CDC puts their stamp on it to say that this is a program that they endorse. But we have been in contact with them. And with everything hazmat-ish related or OSHA related, you have to check with your authority having jurisdiction to get the actual guidance for how you will operate in the field. So with that, we'll get started. The topic tonight is personal protection from viral contamination, best practices, and there's a focus on equipment shortages because, as everyone is aware, there are a great deal of shortages as far as equipment is concerned. I can tell you that having working right now and fielding all of the logistics requests, the requests are coming in at a far greater rate than the equipment is coming in. And anyone who's tried to buy toilet paper or meat or rice or water in the last week is keenly aware of the shortage, and that also extends to personal protective equipment. Things that we've taken for granted for years: medical gloves, masks, eye protection, face shields. It's all in short supply, and so towards the end of this, we'll talk about ways to potentially help your department out. And if it doesn't help you out right now because you don't have the equipment, we'll give you some ideas on how you can plan for the future to be better prepared. Our key objectives this evening will be to develop a basic understanding of the COVID-19 virus, understand limitations on PPE. We will obviously not practice donning and doffing in a group because that would violate all sorts of government official orders, whether or not you believe they have the authority to do so. So we're really going to focus on the PPE portion in the middle and more be a discussion. If you have a question and you type it in the comments, myself, I'll see it, or I have Pat kind of monitoring it remotely, and he can chime in and let me know that I've missed something. But otherwise, hope you enjoy this. So before we talk about COVID-19 in specifics, just be aware that it's an RNA virus, which means that it mutates. In fact, it has mutated 2 times already. First, it needed to mutate to go from a bat to a human. And then it had to mutate again to go from human to human. So there's lots of strains, and before we talk about the current strain, F COVID-19 is confirmed on at least 6 continents. It's highly contagious. It spreads primarily by indirect contact, and symptoms include sleeplessness, increased blood pressure, anxiety, and impaired judgment. The good news is that F COVID-19 is treatable because it's just the fear of COVID-19. Is this a serious topic? It certainly is. But we don't need to be afraid of it. Human coronavirus has been around for a long, long time. Maybe not this strain. We deal with influenza, which kills many more people every year than this. More people have been killed in house fires in Lancaster County that have been killed by COVID-19 in Pennsylvania. That's not to say that we shouldn't take this seriously or that we should make light of a situation. It's to understand that we need to get the facts and we need to get them from reliable sources. So the most effective treatment for fear of COVID-19 is education from real sources, not from Facebook. Just because you read something on Facebook that tells you that parents are outsourcing childcare to India doesn't mean people are actually doing it. The problem with the internet is that everyone can appear legitimate even when they're not. So do yourself a favor and go to real sources of information, cdc.gov, okay, pa.gov, and get legitimate, real information and take the time to read it. This program exists because I recognize that for most of you, going onto the CDC's website and filtering through pages and pages and pages of information isn't something you're looking forward to. And for some of you, that's not the way you learn. So our goal is to take some of that information and put it into a format that's easier to understand. But at the end of the day, even though I'd like to think I've done my homework, you should do it for yourself, and you should check that out. Especially if you're a leader or an officer in your organization, you owe it to the men and women who serve under you to make sure that you have the facts. All right, so the guideline for this presentation comes from the Center for Disease Control and the Pennsylvania Department of Health. Again, they're listed. When this program was about Ebola, they had approved it for Con Ed, and it was approved by Pennsylvania Department of Health Epidemiology. As of right this second, that's not the case for the modifications for COVID-19, but this is where we get our information from. So to understand COVID-19, or the human coronavirus found in 2019, understand that it's not truly airborne. It is spread person to person, and you see everyone wanting these masks because they're afraid that they can just breathe this in out of the random air. The fact is that's not how it works. Someone sneezes, lots of little invisible droplets of water filter out into the air, filling a space of roughly 6 feet, and then when you walk in, very nice, Dwayne, very nice. So when you, walk into that cloud and you inhale it, you have an opportunity to become sick. Or someone sneezes and it lands on an object like a table or a doorknob or a chair or whatever, and you touch it, and then you touch your face. So despite all the other things you see about needing masks and PPE, at the end of the day, if you just stay 6 feet away from people and don't stay around people who are sick, and if you are sick, don't be around people, and you try to keep your area clean and you wash your hands before you touch your face, you're probably fine. That could almost end the presentation right there, but it wouldn't answer what to do for emergency responders who absolutely need to get into the thick of things. So just more detail on this, and for those of you that are also State Fire Academy instructors, I'm aware that there's more words on the slides than what would be appropriate, but this program needs to stand alone without an instructor so that someone could read it and get the same information. So if I fast forward through a slide, it's because we've already talked about what it says. It's just for those folks who might not be able to to see this when there's an instructor giving it. Can someone spread the virus without being sick? There is a lot of empirical evidence that says that a certain percentage of the population can basically carry the virus, be infected with the virus, and show little to no symptoms. If when this is over, you want to go Google Typhoid Mary, it's not the first time that a virus has been had carriers where someone could carry it but not look sick from it. So basically what we're looking to do here is educate folks that there are some new ways this might be able to spread as it mutates, but for right now, most of the people who look sick are sick. Stay away from them and don't touch stuff. All right, we discussed that already. So you're going to see this a million times over, not in this presentation. I promise this will be the last time you see it. I may say it a few times, but wash your hands, cover your cough, preferably not with your hands, or at least your bare hands. Avoid close contact with people, and you could probably end that one right there and then follow it up with who are sick. Avoid touching your eyes, nose, and mouth, and clean and disinfect commonly touched surfaces. We sit there and we come outside the bathroom and you hit the hand sanitizer and you wipe your hands, and then 5 minutes later you touch a doorknob that about 20 other people have touched. Just think about when you're applying what and do things in the right order. All right. So before we get into the meat and potatoes of the stuff that you're probably really interested in, the goal of this program is bridging the gap, because a gap exists between the guidance and the equipment available. If you look at the true guidance, it says you need to wear all of this hazmat stuff. When we switch over to the camera, you're going to say, fill out resource requests for N95 masks and surgical masks and boot covers and head covers and gowns and coveralls and level A suits and all of that stuff. But the reality is right now it's not available. So you're not going to be in a position to get that. So we need to teach you how to use the equipment you have, or teach you how to not need equipment, and so you can use good judgment and keep your folks safe. Because at the end of the day, if you're a firefighter or you're with the fire department, you're still expected to go to house fires. And if you're EMS, you're still expected to go to medical calls. And if you're the police, you're going to go to all sorts of random stuff. So at the end of the day, you're going to have to make do with what you've got, or make the decision to stay home. If you're a volunteer, that's your choice. If this is a career that you've chosen, you're collecting a paycheck, the people certainly expect that you're going to show up and do it. So the biggest thing that I'd like to drive home is that protecting yourself is not about personal protective equipment. It's not your first line of defense. It is your last line of defense. An ounce of prevention is worth a pound of cure. So if you took a full bloodborne pathogens class as opposed to the little online one, you need to start at the bottom of this pyramid. Training and administrative controls save more people from bloodborne pathogens than anything else. For example, in EMS, we train you to hopefully not play in other people's blood. Just because you have work gloves on doesn't mean you need to do it. So we may have an administrative policy, for example, for paramedics that says don't recap needles. That's a training and an administrative item, and if you follow it, your chances of being stuck by a needle are far better than relying on PPE, for example, a glove, to be able to stop a needle stick. The next one up is engineering controls. Engineering controls are things we do to the environment around us to try and make things safer, or to make the things we use safer. For example, for paramedics, engineering controls is needles that have a cap that automatically flips up, or a needle that self-retracts. So that's engineering controls, followed by work practice, which is basically keeping your distance. So the farther away you stay from people, the less likely you'll get hurt. So for example, you have a patient who is conscious, alert, and oriented, capable of walking, and they decided to call you because they'd like to go to the hospital. Instead of donning up in a hazmat suit, tell them to walk in front of you, get into the rig, sit down on the gurney, buckle themselves in, and you can ride at the end of the bench seat. And I would argue that you call Med Command and say, look, we have a PPE shortage, patient is stable. Do you really need that blood pressure? I know that your boss probably makes you think that you do, but do you really? Then lastly is PPE. If you have to get in there, if you have to get within 6 feet of someone, or even worse, you're a paramedic and you have to intubate, or you have to give a nebulizer treatment, or you're an EMT or a firefighter or a police officer and you have to use a bag valve mask, and you're going to be making vapor basically come out of people, out of their respiratory tract, yeah, absolutely, that's when you need to be using PPE. So to drive this point home, and this is way more effective in person, but here's the proof in the pudding. So this is a real picture of, I can't remember the gentleman's name right now, but he sells Second Chance body armor, and he is in fact holding a .357 Magnum to his chest. And he did, I don't know if he does anymore, shoots himself while wearing his body armor to demonstrate how effective it is. But, so body armor is PPE from bullets. Would you put on a ballistic vest? I have one sitting next to me right now. Would you be willing to put it on and let me take 3 shots at your chest. Hopefully you said no. And for the few of you who may have said yes or thought yes, ask anyone who goes to the range with me. It won't help you. I only take headshots. But that's because PPE is not your first line of defense. What's the best way to not get hurt by bullets? It's not to be in the path of the bullet. It's no different than bloodborne pathogens. It's no different than this, where it might be in aerosols that come out of the respiratory tract. Absolutely, staying away is how you're going to keep yourself safe. For years, we've known how to keep ourselves safe from contamination, even before we had bloodborne pathogens and paramedics didn't use gloves and did mouth-to-mouth resuscitation. Ever since we've understood radiation and understood it to be hazardous, we've done time-distance shielding and ALARA. ALARA stands for as low as reasonably achievable. So you can't put the patient in the ambulance and you both ride up front. I understand that. But certainly, if the patient can walk, does the driver even need to come into the building? My guess is they don't. So if you have an automatic fire alarm right now that's reported false, do you need 6 guys running through the building? My guess is no. You have an investigation. You're going to have to go inside, but do you need to take everybody with you? My guess is you don't. Okay? So ALARA is basically the exposure to any hazard should be as low as is reasonable that you can achieve. And it's accomplished through time, distance, and shielding. The less time you spend around a hazard, the farther away you stay from a hazard, and the more shielding you have, the better you will be. But notice the order it's in: time first, distance second, shielding third. So, risk-based approach to PPE. Is it possible to be too safe? I would argue it is. You can wear so much PPE that it hinders your ability to do your job safely. As a hazmat chief, I can tell you that almost all of our injuries, not 100%, but almost all of our injuries on the hazmat ground, so to speak, are slip, trip, fall. We've had a few exposures, but for the most part, it's slip, trip, fall, because they're wearing PPE that's bulky, that blocks their view. They're wearing, sometimes up to 6 pairs of gloves. They have an underglove, then the level A suit has 2 gloves, and then there's an overglove that's Kevlar to protect the underglove, and so on and so forth. It's difficult to grab things like ladders. We had a guy fall from a parapet ladder onto the roof. Fortunately, he fell towards the roof, and he fell 6 feet onto the roof, because if he would have fallen the other way, he would have fallen about 40 feet to the ground. So it is possible that your PPE can create additional hazards. Here we have a picture of another crazy guy. I, again, don't remember his name. It's a Canadian guy that makes basically the bomb suits, and he does the same thing the Second Chance guy does. He puts on a suit, pulls his hands in, and detonates a small amount of C4 to demonstrate that the suit is effective. But take a look at the hands on this suit here. You'll notice that he doesn't have any thick gloves. Anyone want to fair a guess as to why that is? And I know that I can't hear you, but if you think about it to yourself, when he's picking up that bomb that's, shock sensitive, does he really want to have lots of gloves, or does he want to have maximum dexterity? Okay, so there's something to be said there. And then, of course, the other factors that affect PPE is when there's a shortage, what's available. Okay, we'll talk about why wearing too much PPE when it's not necessary during a shortage is a problem. So, triage. You are a single provider with 1 tourniquet. You have 2 patients. 1 patient is unconscious with a wound to the lower leg, not breathing. The second patient is conscious with a wound to the lower leg and trouble breathing. And I'll take a brief pause to try and make this somewhat interactive, although thank you, CJ, for answering the last question. But who would you give the tourniquet to? Patient 1 or patient 2, and why or why not? I'll take about 45 seconds for you to type your response. I agree, Chris. Patient 2. Would you like to type why you chose patient 2? Yeah, still signs of life, and you only have one tourniquet, so you absolutely should give it to patient 2 because it's going to do the most good. You only have one. It's not like you can put it on patient 2 and then take it off and put it on patient 1. You have to do triage. It's a difficult decision. The state is doing it right now with the limited amount of PPE that's coming in. They have to decide which counties get it. They have to decide which municipalities get it, which hospitals get it. It's not pretty. Excellent, Mike Steele. Very good point. Yep, Ron Alt, same thing. Patient 2 is probably beyond hope. So, it's no different when it comes to PPE shortages. Okay? If there are shortages of PPE, it should be prioritized for when it can do the most good. During a shortage, if you overuse your PPE, you are only robbing your future self from having it when it's needed most. We saw this during the Ebola crisis. People were putting on all these hazmat suits for a guy that has a fever. He's not yet even contagious. He can walk to the ambulance himself. Give him a pair of gloves, maybe a surgical mask if you're afraid he's going to sneeze. Say, hey, I'm going to give you a ride to the hospital where they're going to put you in isolation. That's all you need. I mean, it comes down, there's always risks. You've chosen an occupation in which there are risks, and I can't tell you which risks you should take and which risks you shouldn't take. I know there have been discussions over what PPE we should wear as EMS and fire as part of the rescue task force, the coordinated response to active shooter situations. I can tell you my opinion is if you're wearing more than a jock strap and a metal colander, you're probably overdressed. One, you'll scare the guy in his submission, and two, yeah, bullets would suck to be shot by one, but we need to get in there and do the most good. There's risks, and we can minimize it by hanging out behind the cops. So we just need to think about this when your fire truck right now maybe only has 6 N95 masks, using it on that automatic alarm when you don't have to be within 6 feet of anybody. Tell the homeowner, hey, you wait in the kitchen, I'm going to check stuff out, and don't touch anything while you're there. Unless they sneeze or cough within your 6-foot zone, chances are you're at a really low risk. Is it zero risk? No, I'm not going to lie to you and say that it's zero risk. But I am going to tell you that if you use those 6 masks on an automatic alarm, when you get called out for that cardiac arrest for a guy that, had a fever and difficulty breathing and was coughing right before you got there, you're surely going to wish you had it then, and you don't want to have to waste it on stuff that you don't need it. So at some point, we have to be smarter about what we're doing and how we're doing it. So, I love flowcharts. This is one of my favorite ones to explain how to solve problems. And what you're going to see on the next slide is a draft. It's how Hazmat 2 is choosing to address its PPE shortage in terms of COVID-19. It does not mean that is what your facility is going to do. The state has taken this next flow chart, said they liked it, similar to the one we made for Ebola in 2014, and they're going to make a few modifications, and so we imagine you'll see something very similar. But just be aware that what you're about to see on the next slide is not gospel. It's our authority having jurisdiction's opinion, and you can make your own, or your chief can make theirs. So it's a little busy, and I apologize. I have I'm going to pick on paramedics here because I have a few friends that are paramedics on the chat here. Your dispatch, you start off at the top here. Your dispatch for an EMS call. Is there a shortage of PPE? If no, you're going to ask, does the patient have a fever and flu-like symptoms, shortness of breath, chills, or a cough? If no, you're going to ask, are you performing any procedures that are likely to generate respiratory aerosols? If no, follow BLS Protocol 103, standard universal precautions. If no, they don't have a fever, but you are likely going to do something that generates aerosols, you should probably consider wearing a mask anyway, even though a lot of paramedics do not. You're about to get face-to-face with that person, and there's a lot more than COVID-19 out there that can make you sick. So Don't get target fixation and say, well, they tested negative for COVID, so I'm free and clear. And of course, if you say they do have a fever, you can kind of ask yourself some of the same questions. When you get to the shortage side, notice how there's no BLS protocols listed. You're still going to follow BLS protocol 931 for influenza. But now that you have a shortage, you have to make a decision when it's a high priority. So if they have a fever and you're going to perform a procedure such as intubation, nebulizing, putting them on oxygen other than a nasal cannula, they're coughing in your ambulance, yeah, that's a high priority thing, and you should definitely consider using PPE if it's available. However, if they have a fever, a slight cough, maybe you might be in a position to keep your distance. You might be able to, given the fact that we're literally in a state of emergency and a pandemic, you could call the command physician and find out if telemedicine is appropriate. Not everybody who calls for an ambulance needs one, and everyone who's looking for excuses to say that, you have one. I'm not saying it's a great excuse. I'm not saying you'll get what you want. Your mileage will vary, but these are things that have to be considered if we're going to make what little PPE we have last. So the patient has a fever or does not have a fever. Well, we're back to what we had over here. If you're not doing anything that's going to create a respiratory problem, well then lower priority. Even though there's a pandemic going on right now, using that mask now means you might not have it when you're operating over here. So this medium priority is because you should consider wearing a mask every time you're going to do something that's going to generate water droplets from the lungs. We just should. Or not just water droplets, anything from the lungs. This box right here, full disclosure, is the most controversial box. Some people think it should be medium. Again, you need to check with your supervision and find out how that works. So, to simplify the chart even more, is the patient high risk, yes or no? Is the procedure high risk, yes or no? And by high risk, I mean, is it going to produce respiratory aerosols? Okay? Same exact chart, just a little simpler, for some of my paramedic friends. And cops, if any of you are on. Nah, you guys are all right too. You guys are having a rough go of it too because you're having to deal with all the stir-crazy people. So, a lot of words on this slide. I don't expect you to read it. This is the latest interim guidance for what to do for infection control with patients who are suspected or confirmed of having coronavirus disease 2019 or COVID-19 in a healthcare setting. For those of you that work in a hospital, you should totally go to their website and read it, cdc.gov, click on coronavirus, click on healthcare professionals, click on infection control. For EMS, police, and fire, you should consider reading this one here. Okay, interim guidance for emergency medical services, EMS, and 911 public safety answering points. Okay, there's a lot more than what fits on the screen here. You just got to go to the website and check it out for yourself. We're going to distill some of this for you in the next couple slides, but you really need to be checking that because it changes some days on a daily basis, if not a weekly basis. This was last updated March of 2020, or March 10th of 2020. So, here's the part that we were all kind of leading up to. And there's a link at the bottom, which you can't click, unfortunately, but it is on the CDC's website. It's a link to NIOSH. There's a lot of things that they've put out that they haven't really explained very well. Well, I heard that we don't have to do fit testing anymore. Sort of true. If you fit tested on the same respirator last year, NIOSH is saying you can forgo fit testing this year, provided you didn't have any major facial surgery and you didn't lose or gain a lot of weight. But they're still recommending if you've never worn that brand of mask, that type of mask before, how do you know it's going to fit you and it's going to work? You could just be wasting a mask and the stuff's coming right by due to a leak. After the fit testing part, their recommendations are if you don't have a lot, you should consider whether or not you are capable of extending the use or reuse. Their recommendation is that if you have the choice, extended use is favored over reuse because it involves less touching of the respirator, less taking it off, and therefore less risk of contact transmission. And when we get into the details of how they expect this to work, you're going to rapidly find that this is for really healthcare workers working in a fixed facility. This will probably, extended use will be very hard for EMS. Okay? Actually for anybody. Okay? Extended use refers to the practice of wearing the same respirator for repeated close contact encounters with several patients without removing the respirator between encounters. Well, unless you're in a hospital or a nursing home or some other extended care facility, or you are running so many calls that it is back to back to back to back coronavirus patients, then it might work for you. So here's when you should definitely discard your N95 respirator. If you're doing a procedure that's going to create aerosols. Okay? So after intubation or nebulizing, after somebody basically coughs up and you get blood, respiratory or nasal secretions or other bodily fluids onto the respirator. It's done. And they want you to take it off when you exit from the area where you're treating all those patients, because they don't want you to take that stuff out into where there's healthy people. So you can see where this creates a bit of a problem for EMS workers and firefighters, because we don't go from patient to patient to patient to patient in normal conditions. Okay? Consider using a face shield to cover the respirator to help protect it from getting hit directly with anything that may be sprayed or coughed in your direction. And here's that reference to engineering controls, which is more PPEs, not the first line. And of course, performing hand hygiene, soap and water, and an alcohol-based hand sanitizer greater than 60%, I believe is what the current guidance is. Anytime before and after touching or adjusting your respirator, if necessary for comfort or to maintain fit. They really don't want you touching your respirator after you put it on for a variety of reasons. The biggest of is you're risking contaminating yourself. If the mask did its job and caught all the bad stuff on the outside of the mask and then you touch it with your hands, take the mask off and then touch your face, congratulations, you wasted a mask. Pure and simple. All right, reuse. This is that big gray area that everybody says, are they really suggesting that we reuse stuff and that we wash it? Kind of, sort of, yes. Okay, this refers to the practice of using the same N95 respirator for multiple encounters, but removing it after each encounter. And then there's the caveat. There is no possible way you can determine the maximum number of times you can safely reuse a disposable N95 respirator. There's no way. They can't do it. You're basically saying, look, it's better than nothing, and I'll take my chances. You get to that house fire and there's fire blowing out the second floor, but patients reported missing on the first floor. There's a chance, there's a risk. You just have to choose where that line is. Okay, when do we evacuate the structure and go defensive, and when do we go offensive? There's no way to say, well, you always do this or you never do that. Okay, this is exactly the same as extended use. Discard it after you make aerosols into the air. If you get blood or bodily fluids on it, throw it out. After you're done, with close contact with any co-infected or infectious disease requiring contact precautions. That's basically lawyers covering their butts. Okay? Use a clean face shield. That's exactly the same. If you can protect your respirator, it will last longer. All right, and here's where it changes. After your respirator is used, they want you to store them in a clean area and in a breathable container such as a paper bag. Do not put it back into the plastic pouch that it came in. Do not bring a Ziploc bag. If you put your respirator after you've worn it in a Ziploc bag, close it up, put it back in your backpack until your next shift. What you've done is had a Petri dish. Okay? You don't want to do that. If you have a Petri dish, you're going to be growing stuff all over that bag and then all over the inside of your mask. I will point you to where you can see some information on how to, I wish you could see my air quotes, clean a disposable N95 respirator. But the same as the previous comment, there's no way to know how many times you can do that before it's damaged. There's just unfortunately no way. So you want to consider that maybe you shouldn't use the harshest 50-50 bleach solution on your disposable mask. Okay? And again, one of the things that people don't think about is storing it in something like a paper bag so that there is some air transfer and you're not just sealing in all the juices to marinate your respirator in disgusting stuff. And also, you need to label your respirator so that you know which one is yours. Putting it in a paper bag is easy because you can label the outside of the bag. And at the end here, when I switch over to the camera, we'll talk about where you can write on different masks. I have 2 examples, and we'll talk about some places you probably shouldn't write as opposed to places you should. Okay. Clean your hands with soap and water before and after touching it. That's the same as extended use. And again, avoid touching the inside of the respirator. Your hands are pretty dirty. Your gloved hands, if your gloves did their job, you're expecting that they're contaminated. When you take the mask off, pay close care to not touch the inside of it. Okay? If you inadvertently make hand contact with the respirator, make sure you wash your hands as described above. And again, I'll show you some other documentation to talk about the possibility of washing these masks. It's as hinky as it sounds, but the government's like, hey, desperate times call for desperate measures. We'd love to give an N95 mask like a box to every responder, but it's not going to happen. My understanding is that a majority of the plants that make these masks are located in China. And China said to the people that are manufacturing these masks, we need them here. You may not ship them anywhere else. So there's, I think, one plant, I want to say it's Connecticut, but don't quote me on that, in the United States that's trying to crank out the supply for the rest of us. Okay, it's a losing battle. You're not going to get, if you ordered them, you're not going to get them anytime soon. Even if you have that buddy that says, hey man, I know you can sneak me some masks. When 3M produces the masks, or there's some other manufacturers out there, they're basically giving them directly to the federal government, who is determining who gets the higher priority. And so they decide what states need them the most, and then the states decide what counties need them the most, and then the counties have the tough decision of deciding who gets the most equipment. And I'm going to tell you, my guess is it's going to wind up being a lot of EMS and hospitals. Okay? Because for the fire department, we can practice distancing. When you go to that automatic alarm, the homeowner can stand in the kitchen or stand outside, and you can walk through. Okay, remember, it's the idea is that it's passed when someone sneezes and it's suspended in the air. If they've been out of the house for a few moments, you're probably safe to walk in. Don't touch things you don't need to touch, and then when you're done, make sure you don't touch your face. If you have to touch the handrail to climb the stairs safely, fine. But then don't touch your face immediately afterwards. Make sure you can wash your hands. So if you're police or fire, your chances of getting a respirator anytime soon that you don't already have is probably relatively low. That's my guess. Okay? Use a pair of clean, non-sterile gloves when donning a used respirator and performing the user seal check. This is because the outside of the mask is assumed to be contaminated. You put it on because you went into a contaminated area, and you're expecting that the outside of the mask is dirty. And so when you take it off and you hang it to dry, or you put it in that paper bag for storage, when you go to take it out, you need to be wearing gloves because it should be no shock to you. It's not like the trash man shows up on trash day and says, I wonder if I'm going to get dirty and smell like garbage today. He expects it. You should expect that the outside of that mask is dirty, and you should use gloves. And then after you put the mask on, you should discard those gloves because you expect that those gloves are dirty. It's human nature. That mask is going to be uncomfortable. At some point, you're going to get the urge to touch your face. Fight it as long as you can. But we want you to basically try and get that contamination level as low as reasonably achievable. And then we'll talk later about some alternatives to N95 respirators altogether. All right, for both extended use and for reuse, discard the respirator if it's obviously damaged. If it has a hole in it, it's not going to work. Don't use it. if you broke one of the elastic straps, it's not going to work. Don't bother using it. And N95 and P100 filters are kind of unique in the filter world because the longer they're used, the better filter they become, because all the stuff that they're filtering out gets trapped and makes a tighter filter. But at some point, they become difficult to breathe through, and at that point, they're spent. Because once they become too difficult to breathe through, you inhale, and then instead of coming through the filter, the seal breaks, and you're sucking air in behind the mask, and then it's just kind of in your way. So discard any respirator that is obviously damaged or becomes hard to breathe through. All right. This is where I think we, as the fire service, can, if you have the equipment to now, or in the future. I mean, it sucks that we are where we are, but nothing stops us from changing the future. When stuff gets back in stock, we should consider getting APR cartridge adapters for our face pieces. Okay, some say, oh, we can use it for overhaul. I encourage you to, if you get the opportunity, listen to a speech by Christina Baxter. She'll tell you how that's probably not the greatest idea because APR cartridges don't work or are not designed to work in areas where the temperature is elevated, like after a fire. And even some of the best filters in the world don't filter out some of the fire gases. Really, SCBA is the way to go. But if you got a APR cartridge adapter for your SCBA mask and you put a P100 or a HEPA filter on the end of it, congratulations, you effectively have a 100% reusable N95 P100 mask. That's what we're doing at Hempfield Fire Department. If you saw the video I posted a few nights ago, that's what the hazmat team is doing. We are fortunate that we have that equipment and we have those cartridges available. Not everyone is going to have that. Okay? And you can try to order them. In fact, my suggestion might be try and get in line now. I strongly suspect that the back order on P100 cartridges and APR adapters is going to be shorter lived than the shortage on disposable respirators. Because the most expensive part of that setup is the mask, and as a fire department, you've already purchased it. For someone else to buy that, they have to first buy the mask and get fit tested and all the other stuff that goes with it. So if you have SCBA and you don't currently have an APR adapter or P100 filters, I strongly recommend that you talk to your department about, making that order sooner than later so that you get closer to the front of the line. Also, PAPRs. This is primarily healthcare, but with EMS, this is one of those times where, we could use PAPRs more regularly even when there's not an outbreak. And then we would have them available and they would be serviceable when we need it. They're rechargeable, or you can get them that they're rechargeable. A P100 filter, basically, once you open up the wrapper, effectively doesn't expire. The manufacturer usually puts a 5-year shelf life on it, but if you opened it on day one, it's good to go until you can no longer breathe through it or it expires from the manufacturer. I'm pleased to announce to you guys that I have written to the CDC and I've spoken with several people at Pennsylvania Department of Health Epidemiology and their CDC contact and said you need to get NIOSH to approve an extension for P100 filters and the carbon filters and chemical warfare agent filters and get an extension on those just like you did for N95 masks, that we can use them past their expiration date. The manufacturers say it'll still work, but they won't approve it until NIOSH says it's okay. So I wouldn't go out and buy chemical warfare agent cartridges to just use as a P100 filter. But if I had expired cartridges right now, the P100 pre-filter in the chemical warfare agent mask is still a P100 filter. It'll still work. It'll still protect you. And so if we were allowed to use expired equipment, there's a lot of stockpile of expired goods lying around in a bunch of warehouses that would all of a sudden become available for use. So hopefully they heed that, and if they do, That'll get posted out, and if you have that expired stuff right now, don't throw it out. Ben Herskowitz would personally use it. I can't tell you to use it because it's expired and NIOSH hasn't announced a waiver. But absolutely, those are things that you can do future planning to avoid this. I mean, realistically, the P100 filters for some of these masks don't take up a lot of space. I know people hate to hoard things, but these don't take a lot of space, and if you store them properly, this exact situation, you'll be sitting pretty with more equipment than anybody else, and you'll be keeping your folks safer than trying to figure out how to wash an N95 disposable mask. Some highlighted points here, just a reminder for my EMS friends, and certainly there's some folks on the chat here that are way smarter than me when it comes to EMS. But basically, Procedure 103 is the universal precautions. Highlighted, wear gloves on all calls where bodily fluid or contact is anticipated. Okay, if you passed your EMT class, you know the drill. BSI scene safe. Use goggles or glasses when spraying or splashing of bodily fluids as possible. This one is mostly ignored. Okay? Number 7, I should have highlighted it, but I didn't. Preventing exposure to respiratory diseases. Respiratory precautions should be used when caring for any patient with a known or suspected case of an infectious disease that is transmitted by respiratory droplets. Tuberculosis, influenza, SARS, etc. Okay? All of that stuff is in your BLS protocols that you should theoretically already know. And here's some excerpts from the BLS protocol for influenza-like illnesses. Okay? This isn't new. We shouldn't have to wait for COVID-19 or SARS or any of that stuff to remember to read these protocols. If symptoms exist, on dispatch information, considering limiting the number of initial providers. Okay? Right off the bat, they're not saying wear the maximum level of PPE. What they're saying is limit the number of people, ALARA, as low as reasonably achievable. Okay? EMS providers should don PPE for suspected cases before proceeding with patient care or resuscitation. That's also true. But now that we're in a shortage, now we're going to have to make some tough calls as to when we break it out and when we don't. Because if we use it and throw it out, we won't have it when we need it for the really serious ones. Unless this is a really serious one, and then we won't have it for the next really serious one. Or we have to reuse it, which comes with a great deal of risks of cross-contamination and exposure. Or if I'm washing the mask, wondering if the same product I used to disinfect or sanitize the mask also damaged the mask to the point that it didn't work. Also here it says place a standard surgical mask on the patient if tolerated. The theory behind this is if you put the mask on them, it filters what's coming out, and then maybe you and your partner don't need a mask. Because instead of using 2 masks, now you're only using 1, and you're using the surgical mask, which is a lower level of protection, because you can't put a N95 respirator on someone who hasn't been fit tested, and chances are your patient hasn't been fit tested. Okay? You should wear this when in close contact within 6 feet. Again, if you can stay outside of 6 feet, consider the fact that, yeah, you really want to wear all this extra stuff and dress out like a hazmat guy, or gal, but at the end of the day, if you use up all your stuff right now, it's over. And use good respiratory hygiene, non-sterile gloves for patient contact. Okay, nothing new there. So, focus needs to be on controls and not PPE. Limit personnel through time and distance. We still have to support agencies that require assistance. EMS is still going to need lift assists from the 3rd floor, but sometimes we send 6 firefighters who all want to get in there and be helpful, and EMS just winds up carrying nothing or says, I'll be out in the rig setting up. Maybe that's not the option now. EMS, they've already made patient contact. They're already exposed or potentially exposed. So only sending 2 firefighters in to help the 2 EMS providers means that the other 4 people on the engine don't have to be exposed. And if the person helping the lift is wearing the appropriate PPE, they limit bringing that back. And we'll talk about ways to deal with other PPE shortages as far as like not having gowns in a moment. And remember, we're still trying to provide the best patient care possible. We can't just ignore our job and be like, well, sorry, survival of the fittest, good luck. That's not acceptable either. Not in the least. We'll get more into this when we turn to the camera. Here is the summary of changes that were made on March 10th. So if you looked at this at the CDC's website before March 10th, here are the changes. Face masks are an acceptable alternative until the supply chain is restored. So if you really should be using, or they're recommending you use an N95 mask, but they're not available, but you managed to get your hand on dust masks for drywall sanding, they're saying use that in place of nothing. Okay? They're saying, again, probably should have been highlighted in red, respirators should be prioritized for procedures that are likely to generate respiratory aerosols, which would pose the highest risk exposure to the healthcare provider. If you're just escorting them down the stairs and you can stay away and they're not coughing, chances are you don't need a mask. Okay? Use engineering controls and work practices as your primary defenses against exposure as opposed to PPE. Okay? Eye protection gown and gloves. If there's a shortage of gowns, they should be prioritized for aerosol generating procedures. We recognize that everybody is a little bit on edge and nervous. They don't want to bring stuff home to their family. I understand and respect that. But again, if you use up all your stuff, on day one, they're discussing that this could last months. I think somebody said that the last pandemic we had that was actually a pandemic lasted, the shortest one in the last ones on record was 12 months. So if you run out on day one, what are your plans for the next 364, or in this case, 65 days? Okay, when supply chain is restored, you should return to using proper respirators and proper PPE. I think that goes without saying. If it is available and you can get it readily, we don't need to be, rationing out supplies. So, donning is going to be dependent upon your PPE choices. Again, we can't really demonstrate this too much remotely, not right now. Use a checklist, okay? If you're wearing some pretty high-end PPE, use a checklist to make sure you're putting it on in the right order. My suggestion is that you wear 2 pairs of gloves, and if your gown has sleeves, the under pair of gloves go on first so that they're underneath the sleeves, and then the outer pair go on over top of the sleeves. You see there it says put flaps on tape ends. I'm here to tell you that the use of tape in more cases exposes you to a greater risk of contamination than not using tape, because you wind up ripping the suit when you take it off, or now someone has to touch that in order to take the glove off for you. It's actually putting you at a higher risk. So we're not going to get too much into that because I could talk for hours on how much I hate chem tape, but none of you want to hear that, I'm sure. Make sure it's the right fit. You can't wear a respirator that's too small. You can't wear a respirator that's too big. It will not work. It will not protect you. The same with gloves. We joke that everybody fits in double extra large, but if they're falling off, that's not good. And if they're so small that you tear them, that's not good. I get a chuckle out of this story, and I want to preface it with, I'm not laughing that somebody perished. I'm laughing at my mistake. We had a pedestrian struck. It was a run-over situation in a field. They were reportedly run over by the rear axle of a triaxle dump truck. And I reached into the bag and pulled out what was labeled extra large gloves, and when I threw them on, it was readily apparent that they were in fact extra small gloves, but I managed to shove my hands in anyway. I get to the patient, I go to check for a pulse, and I find one, and I'm looking at the injuries, and there's no way this guy has a pulse. But I check, I feel a pulse, and so we start in CPR, hook up the AED. AED says no shock advised, and EMS shows up, and I kind of lean backwards because we're in the farm field, and I put my fingers onto the ground and recognize that the ground has a pulse. No, the ground doesn't have a pulse. The gloves are just so tight I can feel my own blood coursing through my fingers. So you have that, but you also have, if they're too small, they might tear. Okay, they're stretched tight. They're more prone to, if you touch something sharp, tearing a hole in it. And always, you should, when possible, inspect your PPE for damage before you use it. if you pick up your SCBA mask at the firehouse and you look at it and you realize that the entire exhaust valve is missing, don't put it on and go in and fight a fire with that mask. Okay, the same should be true for your N95 masks if you have them, or P100, or whatever you're using. Take a brief moment to look at it and make sure it's not broken. Doffing. If you're going to get contaminated, this is probably where it happens. Again, it'll be dependent upon your PPE choices how that works. If you have the opportunity, inspect for damage before you take it off. It'd be good to know that your glove is torn before you just start touching everything to try and take it off. Where possible, incorporate it with decontamination. If you're able to, similar to what you may have seen in Ebola, if we're able to wash with hand sanitizer the outside of the gloves, if you're reusing some of the equipment, they might spray you down with an alcohol solution, provided they don't spray it directly into your respirator, because it's there to filter particulate, not chemicals, so the chemicals will pass right through the mask. And when your partner asks if it smells like chloroform, you'd be able to answer. Use a checklist. Make sure you're taking things off in the right order. Remove respiratory protection and inner gloves last. Okay? For anyone that's taken one of my hazmat classes, you know that much like Gibbs from NCIS, I have rules and I expect people to learn them. So for you guys, the 44 of you that have stuck around this long, 47, wow, we're climbing. Rule number 1, don't become victim number 2. Because you're only making the situation worse at that point and you can't help anybody further. Rule number 2 is hazmat awareness and bloodborne pathogens basically rolled up into a sentence. If it's a bodily fluid or a hazardous substance, don't touch it. Semicolon. Long pause. If you have to touch it, wear the appropriate personal protective equipment. And then lastly, as it applies here to the next line, outside. Rule 3 is outside touches outside only, inside touches inside only. If you don't know how to properly take off gloves, learn. We'll talk in a moment about using long sleeve shirts in place of gowns. Know how to take it off to better protect yourself. You can't just flip it off like it's your shirt at home. So, Dr. Christina Baxter, I spoke with her the other night as we were preparing this presentation to present to some doctors at PEMA headquarters on Wednesday. And she gave me a 6-hour head start on some papers that she was releasing. And if you go to emergencyresponse-tips.com/papers, you can see the information there. She has information studying what happened with Ebola when they were trying to reuse respirators and what damages occurred and what, some guidance on if you have to rewash your stuff, things to look out for. Absolutely, you should read it. It's a 14-page paper. There's a few charts, but you should absolutely try and, if you're going to try and reuse respirators, that's where I would start with information. She's way, way smarter than I am on all that stuff. And like I said, that was released, she released it publicly Wednesday morning, so it's as up to the minute as we can get. No, to my knowledge, no new information has come out since then. All right, so that's the end of the presentation portion as far as PowerPoint is concerned. Hopefully right now you see an N95 mask on the screen for both live streaming platforms that we're streaming on. So they talked about for reuse that you need to label your name. So the problem is if I write my name right here along the front of the mask, and I'm not endorsing any particular brand of marker, but everybody calls these Sharpies in the same way everybody calls facial tissue Kleenex. What this really is a solvent marker. It has ink and it has a solvent, and the way that it's permanent is it etches away the surface a little bit of what you're writing on to allow the ink to stick, almost like a tattoo. Not exactly, but similarly. So if I write on the front of this mask with a solvent marker, I'm damaging the part of the mask that protects me. You're better off writing it on the side here. where it's not as important. Does the solvent affect the elastic band? Yes. Okay. However, that's not the part that's trying to block out the stuff that you're trying to breathe. Which, by the way, with these style masks, the reason they have expiration dates mainly, other than people maybe want to make money, I can't prove that, but if you look at this one is pretty old, and I don't know if you can see it on the camera or not. I'll try and hold it up and see if it'll focus. Switch it to auto here. I don't know if you can see it or not. All the little cracks in the elastic, because the elastic has begun to dry rot. So the concern is, and also you can see that when I put it back, it loses its shape. So that's the other hazard with reusing these masks. The more you stretch out the rubber bands, if you will, the less likely they are to hold it squarely to your face. So this is an N95 mask. When you put it on, you do need to do a pressure check like you would with an SCBA. You take your hands, you gently cover the mask, and you breathe in and see if the mask sucks gently to your face. It's not going to hold suction like your SCBA mask, but you should do that. The top part up here is flexible. It's designed to adjust to fit your nose, so you should press in and make sure that gives you a tight fit. And I mean, I'm not the OSHA police. You should be fit tested, but at this point I recognize that it's almost any port in a storm. People are going to use these whether or not they're 100% in compliance, and obviously I want to see everybody here be safe. So this, if you're not fit tested, your secret's safe with me. The next mask, if I were buying these and there were not a supply chain problem for fire departments, is actually a P100 mask. It's very similar, just P100. It filters out more particulate. This little piece right here is because this was used for fit testing. When we fit test our folks, we do a quantitative fit test. So this connects to the machine, and the downside of that is it's destructive. We basically put a rivet into the mask to connect the testing port, and that ruins the mask. So we are not fit testing our folks as part of the annual fit testing because of the shortage of masks. One of the other nice things about this mask and some N95 masks is there's a little flapper port in here to make exhalation easier so you don't fog your glasses as much. But I'd like to point out that if this is the type of N95 you have that has a port on it, putting it on the patient when they're sick is not helping you, because all their exhaled air that's bad is coming right out this port. So if it has this on it, it's absolutely, and first off, you shouldn't put an N95 on a patient. You should put a surgical mask. But if this is what you have, a P100 or an N95 with this valve, understand that it doesn't protect your exhaled air. Okay? This would protect some of your exhaled air. This obviously would not. I'll grab one other mask here. There are fold flat masks. This mask has the elastic here, and it unfolds basically to form a cup. What's nice about these is they fit neater in a bag. You still need to be fit tested because this is technically an N95 respirator because it carries a respirator rating. You're supposed to be fit tested, but you also can do non-destructive fit testing if you have the kit for it. But again, you have to be willing to reuse the mask at least once, because if you wore it, you've got all your exhaled germs and gizmos and whatever on it, so don't store it in a plastic bag either. But that's how they look, and there's tons of different styles of these masks. So if your department has put in a request, there's no rhyme or reason to the masks that we get in, and so chances are you're not fit tested. But just be aware that not all masks fit all people. We have a variety of different masks at the hazmat station because we have a variety of different people of different sizes and different facial structures. Not everybody can pass a fit test in those. So, things you can do potentially right now. If you currently use an MSA Ultra Elite face mask, or, as we got fortunate at Hempfield Fire Department, we still had our old masks. And I don't know if this is going to look real well. If not, here's what we're going to do. Hold on a second here. All right, can you guys see that okay? All right, this nose cup is where the push to connect goes in. If you contact the manufacturer, or you have approval, or you've read the instruction manual, this nose cup can actually be unscrewed from the mask. You don't want to do it regularly because you'll damage the plastic, but it does in fact come apart. And when it does come apart, it looks like that. I'm going to see if I can zoom in there. You can see the threads inside the mask. And this one is in fact missing. There should be a one-way valve here. This is why it's being used for training, but you should inspect to make sure that that valve is still there. And then this is a P100 cartridge for MSA. Officially, I have to tell you, if you have an MSA mask, you should use an MSA cartridge, in the same way that while they all have the same, the cylinders all have the same threads, but you know, NIOSH also says you shouldn't buddy breathe, and at some point, if you don't want to die and you're in a building, you're going to say to heck with NIOSH. But this is a 40 millimeter NATO canister thread, and it threads right into the mask. So if you have an Ultra Elite face mask, you can take a couple spares and take them out, and if you can get your hands on these P100 cartridges, which even if they're out of stock right now, I suspect there's less of a demand for these. They'll come in stock sooner than what the disposable masks will be. And the advantage to using this is, one, it's got a face shield, so you're already wearing your safety glasses. You're covering inhalation, ingestion, and the eyes, all with one piece of equipment. This can be washed. Hopefully you wash yours regularly, and so can this be washed. So with a gloved hand, you would remove this, and this can be wiped down with a disinfectant wipe, or you can spray. I wouldn't necessarily use bleach, but there's other disinfectants that you can get that are less harsh, and you spray this down, spray the cloth down, wipe this down, and wash your mask, and then when they're both dry, you can put them back together, and now not only is this reusable to you, but you've cleaned it. It's reusable to someone else, which means that this will last months, because the P100 filter doesn't expire or doesn't stop working. Its end of life from a functional standpoint is until you can't breathe through it. So if you start breathing in and the mask sucks to your face, yeah, it's time to replace this. This could last 6 months. The mask that we put on Squad 69-1 could last us 6 months, as opposed to a disposable respirator. So not everyone's going to have the ability to do this, because either they don't have a mask that you can do this with, or they don't have P100 cartridges. But again, that's something you could get in line for right now to help keep your folks safe. If you're fortunate enough to have an APR adapter, these are smaller P100 filters, but they're still P100. Don't know if that made it better or worse, but you can maybe make out on here the P100, and this just snaps right into the mask. So I take this, push it in, and now it's ready to go. I don't have to make any changes to the mask. And again, these could theoretically sit somewhere just like this, and according to the manufacturer, you do need to replace these every 5 years. But additionally, and I don't have it with me, you could run this with one filter for P100. So there's a blank cap that screws on the end to seal this side, and then you can use this. It'll just look like that. Oh, sorry, because I should put it on camera here. So things that you should consider or may want to consider ordering, they make it for almost every brand of face piece. For my friends out there that use Scott masks, I don't have any cartridges that fit this, but this is an adapter. You slide this off, turn it. It's, you can get cartridges for this. So, like I said, if you have an SCBA, the manufacturer probably makes an APR adapter for it. If you use an MSA G1, they make a really nice, really small one. But again, that's just something you're going to have to get in line for because they're in high demand right now. On the off chance any of my people on here are law enforcement, you may have been issued the traditional gas mask. There you can clearly see the one-way valve that MSA was missing. And again, it's standard NATO thread. That P100 mask, or P100 cartridge, excuse me, fits right into the mask. And there you go. So instead of worrying about that disposable mask, this works, provides protection. Okay, is that intimidating to the public? Probably a little more than an N95 mask, but you have a responsibility to keep your people safe. If your goal is to have separate APRs, technically it requires additional fit testing. I don't endorse any product, or maybe you're a prepper, but this particular mask made by 3M is pretty awesome. Let me grab the filters real quick so I can show you. This mask is designed that it can take either .40mm NATO or bayonet, which means if there's a supply chain issue, you have two options of filters that you can buy. So this one has an advantage in the fact that you can buy two different styles of filters. And if you're a law enforcement guy, they're on both sides so that you can not have your cartridge leaning against your rifle. Other things that you can do to extend the life of your filter, we talked about face shields. This one's disposable, but a lot of you probably in your workshop, if you're welders or grinders, probably have one of these. This is durable. You can wash it, you can reuse it, and it protects your mask. All right. So the last thing I really have for you, unless anyone has any questions. Hey, Walt, what model is that 3M? I will tell you in a second. It looks like it's model 6884 is what it appears to be. I don't have the box for it anymore. All right, so one of the last things I have for you at the moment is we don't have enough gowns, and unless you plan on rolling around in someone else's saliva or giving them a big bear hug while they're coughing, this is still better than nothing. Obviously, I'm not advocating that a long sleeve shirt is a replacement for PPE. I'm merely saying that work smarter, not harder. I'd rather something than nothing. So I can speak for Hazmat and Hempfield that we've instructed our folks that when we come to calls to do two things. One, pack a spare set of clothes, for one, and two, wear a long sleeve shirt because while this isn't waterproof, you can probably get a little bit of mist on this and it not immediately penetrate through. So real quick, I'm going to grab another pair of gloves here. All right, in a perfect world, okay, I would suggest 2 pairs of gloves. This one goes underneath. And if you have the choice, and I recognize that even gloves are hard to get right now, if you can get 2 different colors, that helps to remind you which layer of gloves you're on, because there's no limit other than how many gloves you happen to have as to how many times you can change gloves after touching stuff. So if I touch something that's super contaminated, I can come back, take this purple glove off, put a new one on, and now everything I touch I'm not cross-contaminating. And again, having 2 different colors just makes it easier to see what's going on and which set you're on. There was a question here. Nope, same one. Oh, thank you, John. Appreciate it. Okay, so we've run a call. I'll just pick this P100 respirator as soon as I figure out where I put it down. So, and I'll take this off as quick as I can. Can you still understand me with the mask on through the computer? If someone could just tell me one way or the other. All right, I got a yes. Excellent. So we have to pick the order to take stuff off. Okay? Obviously, this shield is in the way of my shirt. So what we're going to try to do is take this off without touching my head. So I can grab down here. I can lean forward, pull out, and away. So it's pulling away from me, and I can put it right into a trash can. If my shirt is big enough that I can take it off without removing the respirator, that's preferred. So these are the most contaminated pair of gloves. They touch the outside of my face mask, which the outside is maybe another contaminated spot. So I'm going to take off the gloves. Rule number 3, outside touches outside only. I'm going to grab the edge here and slowly take it off. Curl it up. Reach inside, because now that's an inside glove. And gently take it off slowly. That can go in the trash. Now, a lot of folks, myself included, take off a shirt like this. If I take the shirt off like this, my face has to pass right across the chest of the shirt that was on the outside, and I'm likely to get contaminated by whatever is here. So if I take my shirt off this way, I bring it out. Now these are the cleaner of the gloves. So I take it out. Hold your breath. Up and away, and then inside out. Okay? A little hard to tell, but the logo's backwards. So it's inside out. I protect my airway, which is what is the worst. I can change gloves, I can sanitize, or when I take this mask off, I'm going to grab on, pull forward and away from my face. Now, I may lose my glasses here, that happens. So I hold my breath, out and away from my face and right into the trash. And now I'm left with is these, and again, outside touches outside only, inside touches inside only, and that's pretty much in a nutshell the safest way if you don't have a gown. And a gown would be very similar. But don't underestimate the amount of protection that just not having bare skin contact gets you. I mean, think about you're at the sink washing your dishes and you accidentally splash some water on your arm. It's not like you get wet right away. If it's a small amount, your shirt just absorbs it and holds it at the top. So don't underestimate what you have available. And those are simple policies you can put into place and say, look, guys, we wish we had gowns, hundreds of gowns. We don't. But you're going into that, that med assist for lifting. Tell the EMS, we'll take the feet. So we're farthest from the patient's face. We don't have the PPE that they have. Because I'm hoping, like I said, that they're getting the priority. Because it's almost a guarantee that an ambulance is going to dispatch a sick person. The fire department, we may or may not go. Okay? And so I can have that protection just in case, and it doesn't cost very much extra. So, all right. Looks like another question here. Answers. Sorry, there's a delay from when you type in the comments till I get to see it. All right, so are there any questions? I'll do my best to answer them. We've been at it now for about an hour and 10 minutes. I appreciate those of you that hung on as long as you did, although I suppose that you're maybe running out of stuff to watch on Netflix and Disney+. So I appreciate that. So I'll wait a second here to see if anything pops up, question-wise. Nope, nothing seems to be popping up. John Burley, if you could just type yes so that I know when it's actually caught up to real time. And or if there's a topic you'd like us to cover, hazmat or fire, again, the goal is to use this to reach out to the fire departments and maybe even EMS on a regular basis. We're working with Department of Health to figure out if we can do Con Ed this way. We have to just figure out the roster. That may be done in smaller groups instead of on Facebook, but via the other platform we're using right now, which is Google. We're just with so many people on Google, so it's easier, more of you on Facebook. Plus, you don't have to install anything special on your phone or on a computer to do that. So, oh, there's a question about fire police. Yes, thank you. I must have missed that earlier. So fire police, you do interact with the public at times. My suggestion is to limit that interaction. There's a lot of times where you can set up barricades to close a road and then let people be adults and figure out which way to go on their own. Standing out there and inviting a conversation is just putting you at risk. And because you have that option of social distancing, that is probably why you're going to be lower on the priority list. Not that your job is any less important. It just, you have an option to keep your distance that other people do not. If I'm a paramedic and I need to intubate somebody, I can't intubate somebody from 6 feet away. So I need to have that PPE because I need to be in that hazard zone. So for fire police, if you're directing traffic, try to just keep 6 feet away from people where possible. Maybe we decide to close more roads or just use marked detours instead of putting a bunch of people at an intersection to direct traffic. Those are, again, engineering controls are going to be, and work practice is going to keep you much safer than any PPE would. So I know that may not be the answer you were looking for, but that's my opinion on how to keep yourself safe. Again, not that the job is any less important, just you have options that other people do not. And can I post the link to the paper? I think I can. If you hold on a second, I might lose you for a moment. Here's the link to her website. And again, she's got a lot of really good information. She is way smarter than I am. Like I said, not a lot of this is really like original stuff. I'm just a researcher and kind of put it together. I'll tread lightly. A lot of you know that I lack a filter, no pun intended, giving the topic. But this information should have been put out way sooner. And arguably by some different organizations. And my fear was that we're going to issue a lot of PPE to organizations that don't understand how to use it properly, and so they're going to waste a lot of it. And not that they're bad people or they're hoarding stuff, or any of that. They just don't know any better because no one's trained them. I think it's a travesty that EMS can get away with a hazmat awareness class, even though they're expected to wear PPE, come in contact with contaminated people, and possibly perform decon. That's just, something that Pennsylvania needs to do better at. I am appreciative that the state and the CDC have been pretty open to suggestions that we've offered them. Again, officially, they have not approved this content. I'm not going to quote them because I don't want to misquote someone in an email who may have spoken unofficially. They were pleased with the presentation. They did not offer any rebuttal or suggestions. Now, that's not saying that there aren't any, but I'm hoping that eventually you'd be able to take this program on PA Train at your own leisure or some other LMS platform, because obviously we hit roughly 45 people for the last roughly hour and 16 minutes if you exclude the lead-up time when you were listening to my elevator music. We just need to get this information out to more people. Again, I'm not saying that this is, not a big deal or that we should not take this seriously. I'm just saying that we're professionals. We're expected to be calm, collected, and controlled, and that comes from having good education. And if we're not educating our folks, so if you're a chief officer, or I saw looking at some of the people that were on, if you're a heavier hitter than I am, that is to say that you have access or the ear of people higher up in the food chain, absolutely, this should be something that is talked about a lot more than what it is, and in a lot simpler terms. You shouldn't have to try and read through 25 pages of stuff to get an answer on what you should do. And so I saw a few people, I don't know how long they stayed on or scrolled, and again, they're dropping off, which is okay because the class is effectively over. But I appreciate those of you that stuck around. The goal is to do more of these. We're fortunate to have the accounts and the equipment to do this, and we're going to try and partner with the training center to be able to offer classes on a variety of topics. In many cases, there probably won't be a certificate for it. Although we're working with some various organizations to make that a reality. But those will probably be classes that you sign up for as opposed to a Facebook live stream. But if you liked it, just let me know that you liked it, so that way when I show it to the people who I'm trying to convince that this is the wave of the future for at least the next month, if not longer, that they take me seriously, because I don't hide behind the fact that I have some wild and crazy ideas, and I also don't hide behind the fact that probably 50% of them don't pan out. But if you found value in this, let me know so that I can share that with the people that I answer to, and also next time you're sharing this to your friends list, at least your responders or your department groups, so that we can spread the word and maybe make this not such an isolated couple of months. So with that, I thank you very much for hanging out with me, but at some point here, I've got to clean up and get home to my family because I haven't seen them all day. So I appreciate your support, and I hope you have a wonderful evening, and hopefully I'll see you again soon.